What if the difference between a blood sugar spike and a steady, controlled number wasn't just about cutting carbs, but about three vitamins your body might be quietly running low on? If you or someone you love is living with diabetes, stay with me for the next few minutes because what I'm about to share isn't hype. It's backed by real research, and it could change how you think about managing your blood sugar every single day. Let's start simple. Diabetes is a condition where your body either doesn't make enough insulin or can't use the insulin it makes effectively. Insulin is the hormone that acts like a key. It unlocks your cells so glucose or sugar from the food you eat can get inside and be used for energy. When that key doesn't work properly, sugar builds up in your bloodstream instead of fueling your body. Over time, that extra sugar floating around can damage blood vessels, nerves, and organs. There are two main types. Type 1 diabetes happens when the body's immune system mistakenly attacks the cells in the pancreas that make insulin. It's usually diagnosed in childhood or young adulthood, and it's not caused by diet or lifestyle. Type 2 diabetes is far more common, making up about 90 to 95% of cases, and it develops gradually, often over years, as the body becomes less responsive to insulin, something called insulin resistance. Now, here's something a lot of people don't realize. Vitamins and minerals don't replace medication, and they're not a cure. But certain nutrients play a direct role in how your body processes sugar and responds to insulin. When you're deficient in them, blood sugar control can become harder than it needs to be. Today we're going to walk through three vitamins that research has linked to better blood sugar regulation, and I'll explain exactly why they matter, what the science actually says, and how you might talk to your doctor about them. But first, let's understand the bigger picture, because vitamins work best when you understand the whole condition they're supporting. So why does diabetes happen in the first place? The honest answer is, it depends on the type, and it's rarely just one thing. For type 1 diabetes, the cause is autoimmune. The immune system, which is supposed to protect you from viruses and infections, mistakenly identifies the insulin-producing cells in the pancreas as a threat and destroys them. Researchers believe a combination of genetic predisposition and environmental triggers, possibly certain viral infections, sets this process in motion. It's important to say clearly, type 1 diabetes is not caused by eating too much sugar, and it cannot be prevented through diet or exercise. Type 2 diabetes is different. It develops when your cells gradually become resistant to insulin's signal. Your pancreas tries to compensate by producing more and more insulin, but eventually it can't keep up with demand, and blood sugar levels start to rise. Several factors contribute to this. Excess body fat, particularly around the abdomen, is strongly linked to insulin resistance because fat tissue can release substances that interfere with insulin signaling. A sedentary lifestyle plays a role too. Physical activity helps your muscles use glucose more efficiently, so when activity is low, glucose tends to build up. Genetics matter as well. If you have a parent or sibling with type 2 diabetes, your own risk increases significantly. There's also a growing body of research on the gut microbiome, chronic low-grade inflammation, and even sleep quality as contributing factors. And yes, nutrient status fits into this picture too. Some studies suggest that low levels of certain vitamins and minerals, including the ones we'll discuss today, are more common in people with insulin resistance and type 2 diabetes, though scientists are still working out exactly how much of this is cause versus effect. There's also a less common form called gestational diabetes, which develops during pregnancy due to hormonal changes that affect insulin sensitivity, and it usually resolves after delivery, though it does raise future risk of type 2 diabetes for the mother. One of the trickiest things about diabetes, especially type 2, is that it can develop silently for years before anyone notices anything wrong. That's exactly why regular checkups matter so much. But there are signs worth knowing. Increased thirst is one of the earliest and most common symptoms. When blood sugar is high, your kidneys work overtime, trying to filter and absorb the excess glucose. And when they can't keep up, that sugar gets excreted into your urine, pulling fluids from your tissues along with it. This leads to frequent urination, which in turn leads to dehydration and even more thirst. It becomes a cycle. Fatigue is another big one. When glucose can't get into your cells properly, your body is essentially starving for energy, even though there's plenty of sugar in the blood. People often describe this as an exhaustion that doesn't improve with rest. Blurred vision can occur because high blood sugar causes fluid to be pulled from the lenses of your eyes, affecting your ability to focus. Slow healing cuts or wounds and frequent infections happen because elevated blood sugar can impair circulation and weaken the immune response. Unexplained weight loss. particularly in type 1 diabetes, happens when the body, unable to use glucose for fuel, starts breaking down muscle and fat instead. Some people also notice tingling or numbness in their hands or feet, which can signal early nerve involvement, something called neuropathy. And darkened patches of skin, especially around the neck or armpits, can sometimes be an early visible sign of insulin resistance. The tricky part, and I want to be honest with you here, is that type 2 diabetes symptoms can be so mild or gradual that many people don't notice anything until a routine blood test reveals high glucose. That's not meant to scare you. It's meant to underline why screening matters, especially if you fall into one of the higher risk categories we're about to cover. Let's talk about who is more likely to develop diabetes, particularly type 2, since that's the form most influenced by lifestyle and biology working together. Age is one factor. Risk increases as you get older, particularly after age 45, though we're seeing more younger adults and even adolescents diagnosed with type 2 diabetes than in past decades, largely tied to rising rates of obesity. Family history matters a great deal. Having a parent or sibling with type 2 diabetes raises your own risk. Ethnicity plays a role too. Research consistently shows higher rates of type 2 diabetes among African American, Hispanic, Native American, Asian American, and Pacific Islander populations, likely due to a combination of genetic and socioeconomic factors. Body weight, especially carrying excess weight around the midsection, is one of the most significant modifiable risk factors. Fat cells, particularly visceral fat surrounding your organs, can release inflammatory compounds that interfere with how insulin works. A sedentary lifestyle compounds this risk, since inactive muscles are less efficient at absorbing glucose from the blood. High blood pressure and abnormal cholesterol levels often travel alongside insulin resistance. Doctors sometimes call this cluster of conditions metabolic syndrome. A history of gestational diabetes during pregnancy increases the likelihood of developing type 2 diabetes later in life, as does having polycystic ovary syndrome, or PCOS. Sleep also matters more than people realize. Chronic sleep deprivation and conditions like sleep apnea have been linked to impaired insulin sensitivity. And then there's prediabetes, a stage where blood sugar is higher than normal but not yet high enough to be classified as diabetes. Millions of people are walking around with prediabetes without knowing it, and this is actually the stage where lifestyle changes have the most powerful preventive impact. I want to pause here and say something important. Having risk factors doesn't mean diabetes is inevitable, and not having them doesn't mean you're immune. These are statistical patterns, not guarantees. Knowing your personal risk profile simply helps you and your doctor decide how closely to monitor things. This is the part you've been waiting for, so let's dig into it properly. Both the general lifestyle foundations and the 3 vitamins that research has connected to better blood sugar management. First, the foundation. Nothing replaces the basics: a balanced diet rich in fiber, lean proteins, and healthy fats, regular physical activity, maintaining a healthy weight, managing stress, and getting adequate sleep. Medication, when prescribed, plays an essential role for many people and should never be stopped or adjusted without a doctor's guidance. With that foundation in mind, let's talk about vitamins DASHs, because deficiencies in certain nutrients can make blood sugar control noticeably harder, and correcting them, under medical supervision, may offer real support. The first vitamin is vitamin D. Vitamin D isn't just about bone health. It has receptors on the cells in your pancreas that produce insulin, which means it's directly involved in how your body manages blood sugar. Research has found that people with low vitamin D levels tend to have higher rates of insulin resistance, and some studies suggest that correcting a deficiency can modestly improve insulin sensitivity and fasting blood sugar in people who are low to begin with. The relationship appears to go both ways too. Chronic inflammation associated with diabetes may also lower vitamin D levels, creating a cycle. Vitamin D is sometimes called the sunshine vitamin because your skin produces it in response to sunlight, but many people, especially those who live in northern climates, spend most of their time indoors, have darker skin, or are older adults, don't get enough from sun exposure alone. Food sources include fatty fish like salmon and mackerel, egg yolks, and fortified foods like milk and cereal. Because it's genuinely difficult to get enough through diet alone, many doctors recommend a blood test to check your levels and may suggest a supplement if you're deficient. The key word there is test. Vitamin D toxicity from oversupplementing is rare, but possible, so this isn't a vitamin to just guess on. The second vitamin is vitamin B12. This one is especially important for a specific reason that often gets overlooked. Metformin, one of the most commonly prescribed medications for type 2 diabetes, can interfere with the body's absorption of vitamin B12 over time. So if you've been on metformin for a while, B12 deficiency is a real and well-documented possibility, and the symptoms of B12 deficiency, like fatigue, tingling in the hands and feet, and brain fog, can actually overlap with or be mistaken for diabetic neuropathy, which makes it easy to miss. B12 plays a crucial role in nerve function and red blood cell formation. For someone with diabetes who may already be at risk for nerve damage from elevated blood sugar over time, having adequate B12 is particularly important for protecting nerve health. Good dietary sources include meat, fish, eggs, and dairy, which is why B12 deficiency is also more common in people following vegan or vegetarian diets, regardless of diabetes status. If you're on metformin long-term, it's worth asking your doctor about an annual B12 check. It's a simple blood test, and catching a deficiency early is far easier than reversing nerve damage later. The third one is magnesium. Technically a mineral rather than a vitamin, magnesium earns its place on this list because the research connecting it to blood sugar control is some of the strongest we have. Magnesium is involved in over 300 enzymatic reactions in the body, including the ones that help insulin do its job. Studies have shown that people with type 2 diabetes are more likely to have lower magnesium levels, and low magnesium has been associated with greater insulin resistance. Some research even suggests that higher dietary magnesium intake is associated with a lower risk of developing type 2 diabetes in the first place. Why does this happen? Part of it may be that elevated blood sugar causes the kidneys to excrete more magnesium through urine, creating a self-perpetuating cycle where high glucose leads to magnesium loss, which then makes insulin resistance worse. Good dietary sources include leafy green vegetables like spinach, nuts and seeds, particularly almonds and pumpkin seeds, legumes, whole grains, and dark chocolate in moderation. For some people, especially those with poor kidney function, supplementing magnesium requires caution and medical guidance, since the kidneys are responsible for clearing excess magnesium from the body. Now, here's the responsible caveat I want to make sure lands clearly. None of these three nutrients are a substitute for prescribed diabetes medication, insulin therapy, or your doctor's treatment plan. The research on vitamin D, B12, and magnesium shows associations and modest supportive effects, particularly in people who are deficient. It does not show that supplementing these vitamins cures diabetes or replaces the need for monitoring and medical care. If you suspect you might be low in any of these, the right next step is a simple blood test, not guessing your way through a supplement aisle. Your doctor can tell you your actual levels and whether supplementation makes sense for your specific situation. Beyond these three nutrients, the broader prevention and treatment toolkit remains essential. Regular physical activity, even a 30-minute walk most days, improves how your muscles use glucose. A diet built around whole foods, fiber, and minimizing refined sugars and processed carbohydrates helps prevent the dramatic spikes and crashes that strain your system over time. Routine monitoring, whether that's home glucose checks or regular A1C testing through your doctor, helps you and your healthcare team catch problems early and adjust your plan as needed. And if medication is part of your treatment, taking it consistently as prescribed remains one of the most powerful tools available. If this video helped you understand something new about diabetes and these three vitamins, do me a favor and hit that like button. It genuinely helps this information reach more people who need it. And if you haven't already, consider subscribing, because we're covering topics just like this one every week, breaking down real research into something you can actually use in everyday life. I'd also love to hear from you in the comments. Have you ever had your vitamin D, B12, or magnesium levels checked? What did you find out? Sharing your experience might be exactly what someone else watching needs to hear today. Managing diabetes isn't about chasing one magic fix. It's about understanding your body well enough to give it what it actually needs, one informed choice at a time. You're already doing that just by being here. Take care of yourself, and I'll see you in the next video. This is general information. Please consult a doctor for medical advice.